Healthcare systems across Canada are dealing with what we've been telling you about all morning, this viral triple threat. Cases of COVID-19, the flu, and RSV are rising as we head into the winter months. It is a trend that doctors are watching closely, some of them sounding the alarm, as staff in many hospitals are already overwhelmed. Joining us this morning is the president of the Ontario Medical Association, Dr. Rose Zacharias. Welcome back to the show.
Thank you so much.
Boy, we've been seeing this on doctors' social media. We've been reading about it in the paper. There's a shortage at the hospital. Parents have sick kids. Everybody's a little frustrated. Everyone's confused. We know resources and staff are spread thin. What is the plan to deal with, first of all, respiratory viruses in the coming months?
So it's important to remember that this is the first year since the pandemic began that we're heading into a normal flu season. And the flu has arrived early. This time last year, we had single-digit cases.
Wow.
Now we've recorded well over 1,000 flu cases coming into our hospitals. And so that, coupled with the COVID-19 virus still circulating and RSV, which is another common childhood virus that comes around this time of year, we're seeing that increased strain in the emergency departments and healthcare teams still dealing with burnout. So we do have some solutions. Ontario's doctors are talking about alleviating some of the strain, but we need to be implementing those solutions now.
Yeah, the Ontario Medical Association calling on people to get vaccinated against COVID-19. Mask while you're indoors. That's been a hot topic of conversation. Canadians are increasingly frustrated both with masking and with vaccinations. We know that because the upshot on getting your vaccinations is down, right? Or 18% of us have received a booster in the last 6 months. That's really low. What's your response to that trend?
So vaccines are safe and effective. It's something that we need to prioritize. It's something that you need to go out of your way, even right now, and get, because the upside of not getting, the downside of not getting vaccinated is we're going to continue to see the strain in hospital. And so COVID-19 boosters are important. Everyone needs to be getting their flu shots. And when we do that, when we prevent ourselves from getting sick, when we prevent ourselves from getting so sick, even if we get the virus, from landing in hospital or an emergency department or transmitting the virus to someone else, we alleviate the strain inside the hospital for people who are a bit more vulnerable or who just, with bad luck, are going to get sick this year and needing the hospital to support them.
You know, you've probably heard this a lot too, and we should point out you spent most of your career working in hospitals. You know, parents saying, okay, I don't have a family doctor, so I'm trying to treat this at home. I cannot get access to the medicines that I need. The walk-in tells me to go to the hospital. The hospital's like, look, we're jammed. Parents aren't trying to create a problem, but they're stuck in the middle of it, and they have sick kids on hand. So, like, what's your best advice?
I'm a parent too, and so I understand it's really worrisome when you see your kids get that fever, develop symptoms of a cold, wonder if this is going to get worse. First and foremost, if you're able to, and we know not everyone in Ontario has a family doctor, but to reach out to your primary care provider. And secondly, if you're coming to the emergency department, to have a little bit of compassion. You'll meet that triage nurse up front who will assess your symptoms, and you may have to wait. We are seeing waits double and triple the amount of times, and waiting rooms are crowded. But our healthcare teams that are showing up, those doctors and nurses, they want to give you the absolute best care that they can. Our resources are strapped right now, so they're doing their best. And we know that parents are worried, and so being mindful of that is going to do us all some good.
One of the discussions that's come up around masking in schools, in particular for kids, because a lot of the cases of cold and flu are kids and teens, is masking in schools. But then the question is raised, are we just putting off the inevitable? So we've had these 2 years of no one being sick. Now we get these viruses and they're sick. If we put the masks on, are we just delaying being exposed to what we're going to get exposed to next season anyway?
So having the public health restrictions and precautions over the last years has put kids in a little bit more of a vulnerable situation. They haven't been exposed to some of the viruses. And yet we're at a place now in the pandemic where there's not an official mask mandate, certainly not at schools and public places. And yet it's always a good idea to wear a mask when you're in a crowded place, when you're gathering with people who are a bit more vulnerable. And these are things that we can do. Washing our hands, getting our COVID-19 vaccines up to date, and wearing masks inside when people are vulnerable and crowded is going to be helpful to us all.
We know that money is going to help our healthcare system and being able to allocate it in places. And you've been on here talking about sort of the 5-point plan. But we saw the health talks fall apart in Vancouver between the feds and the provinces. Where does that leave us?
So Ontario's doctors have been very clear. We need an increase in the federal portion of the provincial healthcare spending. We have investments that we need to make to catch up on the surgical backlog that the pandemic has left us with, the emergency department overwhelm. We need an investment in community care so that people who've been admitted in hospital can be discharged to the community and cared for there. And we need to deal with the doctor and nursing shortage that we're seeing. So we need an investment, and calling on the federal government to increase their Canada Health Transfer is what doctors have been saying all along.
Dr. Rose Zacharias, great to have you here this morning. Thanks so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.